And for those of you that are joining, welcome to V is for Victory. We're going to give it about another 30 to 45 seconds and then we'll get started. Thank you. Well, good evening, everyone, and welcome to V is for Victory, straight talk about COVID-19 with community leaders across Houston and hosted by Community Health Choice. I'm Lisa Wright. I'm the president and CEO of Community Health Choice, and I'm so glad that you're joining us tonight, along with more than 700 Zoom participants and many more joining us via the Facebook live stream. We will start the panel in just 1 minute as all the Zoom participants who RSVP'd enter the webinar. We are in webinar format tonight, which means only the panelists and the moderators are on screen. Although all Zoom participants can add questions to the Q&A box, a reminder that only the Zoom participants and the panelists will be on screen. And just a reminder, this session is being recorded and it will be available to watch afterwards. And so as we begin, I want to introduce our panelists formally, but first we would like to ask a survey question, which we will also ask others throughout this webinar. We appreciate your thoughtfulness and a candid response. On your screen, you should see the following question. What do you think about COVID-19 vaccine? If you are joining via Facebook, please add your answer to the Facebook comments. We will see the responses coming in. And remember, participants tonight during our conversation, please add questions into the Zoom Q&A or the Facebook comment section. Okay. Erin, has everyone had a chance to submit?
Most everyone has responded. I think we have a good sampling.
Okay. Well, thanks. And now okay. So when we look at the results, about 41% said that they've already received their vaccination. And then we have another 31% that said they're ready to get their shot, which is great news. And then we have about 18% that said they want to learn more. And then we have about 10% that say at this time, they don't plan on getting the vaccine. Well, our hope today is that as you get the opportunity to listen to our leaders here in the community, that one, you will have the opportunity to learn more, and two, we can provide that information that will encourage you to get vaccinated. So I'd like to take the time to introduce our panelists. We'll do this alphabetically. So we have George Anderson. He is the Chief Operating Officer of Fountain of Praise. Next, we have Dr. Ann Barnes, the Chief Medical Officer of Harris Health System. Then we have Dr. Charlene Flash, the CEO and President of Avenue 360. And then we have Dr. Vernica Porter Sales, the Chief Medical Officer at Community Health Choice. And then we have Dr. Brian Reed, Chair of Clinical Services, University of Houston College of Medicine. And again, I'm Lisa Wright, President and CEO of Community Health Choice. So panelists, thank you so much for joining. And I want to just start out with a question for each of you, similar to the survey question. So many of us on the call tonight are deemed essential workers. So let's start with George. And the question is, have you gotten your vaccine yet? And if so, did you experience side effects?
So thank you, Lisa. I have gotten first and second dose of the vaccine. First one, no problem. Second one, had a little bit of fatigue, a little bit of headache. I probably went into hypochondriac mode. So the second one kind of made me nervous, but after a day or two, I was back to normal. Back to normal.
Well, good. And Dr. Barnes, what about you?
Yes, I had both of my shots. The first shot, I had a little arm soreness, but that went away within 24 hours. And then the second shot, I too had some symptoms, a little headache, a little fatigue, and I had chills. But
Okay.
those went away quickly. And I believed that I felt like this is a good sign because that means that I am having an appropriate immune response. So was happy that they went away quickly.
Well, that's good, and that's a great way to actually look at it. What about you, Dr. Flash?
So I received my first dose of the Moderna vaccine in early January and my second dose in early February. I have a history of several allergies, and so I was very cautious when getting my vaccine. And so I was monitored for 30 minutes instead of the usual 15 after getting my vaccine. But
Okay.
the only thing I experienced was some tingling of my fingers. And, this was something new and it was early. And so I was watching myself very carefully. And by the following day, I felt fine other than some arm soreness. The second dose, I was extraordinarily tired. I came to work after my second dose, went to
Wow.
the meeting, turned around and went home and slept for several hours. And as Dr. Barnes noted, that's how I knew that my immune system was kicking into gear and that I was going to be protected. And by the following day, things were back to normal.
Okay. Thanks so much. And then what about you, Dr. Porter Sales?
So I had what I would call minimal symptoms. I had the arm soreness similar to Dr. Barnes that kicked in probably 24 hours after I received the vaccine. However, with the second dose, it seemed as if my symptoms kicked in sooner. I think I got my shot that Friday morning around 7:30, 8 o'clock. And around 3 p.m., I began to feel extremely tired. My arm was actually sore. And
Mhm.
then I went home and kind of slept all day. No chills, but I guess a different sensation. Wouldn't call it muscle aches, but my skin felt different. Like it was sore, like my skin was sore. But that went away about 24 hours later, and I was fine, back to myself. So thank you.
Okay. And then Dr. Reed.
Yeah, so I got my first dose in late December and my second dose in mid-January. And really the only thing I experienced with both immunizations was just soreness in the arm that lasted a couple days. And that was it. I mean, really no issue.
Okay, well then that's good to hear. It sounds like that there was a variety here, but the one common theme was that it all went away in about 36 hours. And so that's great to hear. Well, some people are pretty hesitant, as you all know, about getting the vaccine. And recent research from the University of Houston indicates that a common concern is that the vaccine is too new. And many people want to wait and see how it works for others. Even when we just did our poll, there were people that are on tonight that want to wait and see. And from the research, what we're finding is that 61% are listing this as a major reason, combined with the related reason that they are worried about possible side effects. And so for each of you, what would you say to people that are hesitant about getting the vaccination? And we'll open this up for everyone because I think each of you have a great point to bring to the conversation. And so, Dr. Barnes, let's start with you.
So when I talk to people, and to be honest, there are several staff at Harris Health where I work who were hesitant about getting the vaccine because they were worried about side effects. I asked them to really think about weighing the costs and benefits of either going unvaccinated and unprotected, getting COVID, and not being certain how they would respond to the infection. They could get very ill, end up in the hospital, and even in the ICU versus getting the vaccine. And all of the data that we have to date demonstrate that the vaccines are very safe. And so I asked them to consider which they wanted to do, get protected based on the evidence and the science that we have, or risk getting infected and then potentially infecting others that they care about.
Yeah, yeah, really great point. Dr. Flash?
When I talk to people about vaccine hesitancy, I often note that it's okay to be hesitant, right? I'm a cautious person and I'm thoughtful, and this all moved really quickly. I think that when you think about how fast it happened, it makes people nervous, and that's understandable. But what I remind people is that we are in the kind of community when you have a really big problem, it requires really focused and coordinated solution. And these vaccines that we now have access to aren't just something that was tossed on us, but over 150 vaccines were examined. And out of those, we only have 3 that made the cut as of today that could be used for emergency use authorization. And so when you look at that, you say, well, you know, it's not that, that these things have not been well examined. It's that we said, goodness, so many thousands of people are dying in our communities, and we need to do whatever we can to make moves so we can get our lives back to normal. So it's okay to be hesitant, especially when things move quickly, but it's also important to look at the data, talk to people, make sure you get your questions answered. And then once you have your questions answered, to do all you can to protect yourself and your family members and your community members so we can all get back to a new normal.
Yeah, absolutely. And Dr. Reed?
I like to remind people that this is really not a new concern. We've been worrying about coronaviruses for some time. We've had interest in developing a vaccine going back at least 10 years. When you think about some of the near misses that we've had SARS, which mostly affected South Asia. There was MERS that affected the Middle East. And unfortunately, this one affected the whole entire world. But there were researchers investigating and developing and targeting ways in which we could counter these viruses for some time. So what happened is, we had the global pandemic sort of lighting the fuse to really sort of push these research that's been ongoing across the finish line. So I point that out. And then lastly, anytime we sort of take a medication, take a vaccine, we've got to look at the risk and benefits. At this point, we've had millions of people contract the coronavirus. We have millions of people get the vaccine. We know that millions of people contracting the coronavirus usually leads to hundreds of thousands of people in the hospital and tens of thousands of deaths. Whereas the vaccine, we're just not seeing that in terms of side effects or adverse outcomes.
Yeah, definitely. Mr. Anderson, what would you add?
I might add that initially I was hesitant, given the administration under which this vaccine was developed. I was very concerned, very suspicious, almost cynical. But as I did a deeper dive, for one, very comfortable with the mRNA technology. It is, as Dr. Reed said, it's not brand spanking new. I think back in 2011, they really made some strides in doing the mRNA vaccine development. And so I've been able to share that experience with people, and I think people have been receptive because, again, I was very upfront that, hey, I'm not taking this vaccine until I see or have a comfort level. I think the other thing that I've been stressing recently is that even if you're asymptomatic, after you've contracted COVID, that there are signs of the long-term effects that can be very, very harmful. And so a lot of people don't really realize that. They think if I get the COVID and I don't show symptoms, that I'm out of the woods. And I'm like, no, that's not the case. So again, I think just having very honest discussions have worked with me, getting people to be open to it. And especially my number one person, I think I shared with one of the doctors earlier, my mom was very hesitant about the vaccine. And so we had a number of phone calls and dialogue, and now she has gotten totally comfortable with it.
See, that's good. That is good. And Dr. Porter-Sales?
So to kind of piggyback on what George was sharing is that you really want to understand what is it that's causing the hesitancy. And when I think about it, I think back to my experience at Tuskegee University. and why it may be happening. I was a student at Tuskegee, and there was a measles outbreak, and knowing that that experiment took place there, and not really trusting them, many, many years later, what were they going to inject us? Was there truly this measles outbreak? And so realizing that this is something real and true. And so I drove home 11 hours to Houston to get my vaccine. I refused, and so did some of my other classmates. So I want that that other doctors that are caring for us that maybe not look like us realize that it is a true reason behind why we are hesitant for that. And a lot of it could stem from slavery, right? We think back, it goes back many years. And so when we begin to have conversations with each other and others having conversations with them as patients, our community, they need to keep those things in mind and try to speak to the facts, but also just listen to what their hesitancy is. And I think part of that will bridge the gap between them understanding how important it is to get this vaccine and the repercussions of doing that. And also realizing what George said, that if you get this virus, you actually could potentially take years off your life. So you may recover now, but then what, right? And so we understand they don't feel comfortable with the vaccine now, but there's more science behind that than just getting the condition. So that's
Yeah.
what I like to add.
And so Dr. Porter-Sells, I think that brings up a really great point. What we're hearing just in the research is that there are a lot of Black Americans that are hesitant to take the COVID-19 vaccination. And so for Dr. Barnes and then for George, when you think about this and you think about what you're hearing, do you agree that this statement is true? And then if so, what do you think the issue is? And Dr. Barnes, we can start with you.
Thank you, Lisa. So I agree with much of what Dr. Porter-Sells just shared. Hesitancy, I think, is based in a history of not being treated justly in the Black community in the past. And the Tuskegee experiment in particular was government sanctioned. So I feel like people carry that legacy of concern and mistrust forward. I think that there is a real opportunity for trusted primary care doctors and providers to help talk to people, to help them move beyond the mistrust of the past toward a time when those of us who are involved in healthcare are genuinely concerned and want to prevent disease and promote health among our community members.
Yeah. And George?
And so the historical is more than overwhelming, but I also want to point to the contemporary, to what people experience now in terms of, we've had members in the church that have come down with COVID, and the church becomes a safe space. And especially I have to applaud our wellness ministry. Moreover, our senior pastor, Dr. Wright, and co-pastor Mia Kay, we really have created safe space to have the discussion about this. And so there have been instances where we've had to advocate to some of our members, hey, it sounds like you are exhibiting signs of COVID, don't let them send you home. And in one instance, one of our members, after 3 attempts of accessing care, finally got the treatment that she needed. And so, again, when we look at that mistrust, it's well-deserved. And one of the things that we've not shied away from as a ministry, because we're again, safe place or safe space, people trust us. And so we have to be very, very honest and transparent and say, oh yeah, there's some problems, but you need to make sure that you're managing your care and that you're not letting, for whatever reason, someone give you secondhand treatment. And so I think that's very, very important when we look at this whole hesitancy, which again, I call the mistrust that is very apparent in our community.
Yeah. And when you talk about trust and we talk about the mistrust,
Hi, this is one of the community health choice facilitators.
Thank you.
Lisa,
Yes.
you froze for just a moment. And so we lost you just after you began to speak.
Okay. I was saying that we are one of the things that people are talking about are how quickly the vaccines were developed. And I was asking Dr. Flash and Dr. Reed if they can comment on, are the vaccines actually safe? And then what about side effects? And Dr. Flash, we'll start with you.
Thank you, Lisa. So yes, the vaccines are safe. You know, I would remind people that every medication that one has good elements and bad elements, even Tylenol, right? And a vaccine is no different. I think when we look at what's good about the COVID vaccines, those that we have available right now are extremely effective. If we look at, well, what's challenging about them is that people can experience side effects. Now, when you think about those side effects, they're generally very mild, especially with the first dose. Sometimes with the second dose, the side effects are more severe. You know, I don't want to pretend. I want people to understand that possibility so that if it happens, they don't feel frightened. They know that this is something that's normal. But we do know that although people may experience some side effects, that it's so much better than getting infected with disease, potentially, even if you don't have severe symptoms, you may infect your grandmother or your child or your coworker or people that you're caring for or encountering at your job or in the community. And so the risks are far less than the great benefit.
Thank you for that. And Dr. Reed?
Yes, so I agree. The clinical trials, both of them for the Pfizer as well as the Moderna vaccine, which are the ones that are currently being distributed here, both of them had over 80,000 participants, all of which had a very diverse group of individuals. So there were African Americans, Hispanic individuals, Caucasians, as well as Native Americans included in these studies. And they also included people with pre-existing medical conditions in those trials. And, you know, the outcomes of the trials were that they were safe and effective. I mean, the 95% effective rate in terms of prevention of severe infection, I mean, that's remarkable. It's much better than what we see with the flu vaccine. And at this point, I mean, we've now administered here in the United States about 76 million doses. When you sort of think about sort of globally, I mean, it's been administered in Europe as well as Asia. It's like, you know, we've got hundreds of millions of people now that receive the vaccines. And again, when you compare it to actually catching COVID, it's the vaccine's much safer.
So you've shared that the vaccine is safe, but then there's other questions that come up. I'm pregnant. Should I take the vaccination? So Dr. Porter-Sales and Dr. Barnes, how would you respond to that? And let's start with Dr. Porter-Sales.
So obviously you need to weigh and have conversations with your practitioner, your OBGYN, you know, weigh the risk of getting COVID as we spoke to, even if you weren't pregnant. And then now you have this pregnancy. And so your concern is for your unborn child and for yourself. And there may be a time when it's better to get the vaccine. That is what's being recommended. But again, this is an individual decision that you should have made in conversation with your treating OBGYN. Another thing that comes up when you think about that is breastfeeding as well, right? There's some concerns about breastfeeding and getting that, and is it going to be passed? Again, you still need to have that conversation. The vaccine was not studied in like infants, right? And so more to come on that, but there's a lot of times that those antibodies are very protective of that infant when passed. And so with that, have the discussion, make an informed decision. It could be better to get that vaccine, or in certain situations, it may be better just to wait until you're no longer pregnant. So Dr. Barnes.
I would echo much of what Dr. Porter-Sales said. I have seen several pregnant women get vaccinated safely without any symptoms. In conversations with our infectious disease experts, they also recommend it. But at the end of the day, I do believe it is most wise to have a conversation with your OBGYN. But all of the data that we do have suggests that it's safe in pregnant women. And my understanding is that the research is ongoing now, and we'll have better data in the coming months about how pregnant women or lactating women do with the vaccines.
Perfect. Thank you both. And so we've heard just feedback from each of you on the research that has been done around the vaccination. We've heard that from your seats, you believe that it's safe. Erin, would you put the second survey question on the screen? And the survey question is, do you have a trusted source of information about COVID-19 vaccine? And if you're joining us via Facebook live stream, please just put your response in the comments. So let's give everyone a moment to respond to the question. Erin, do we have majority of the responses?
We do. I think we can go ahead and share those results. We have about 66% of respondents.
Perfect.
And here we go.
Wow. I mean, almost 80% of you said that you have a trusted source, whether it's your medical home, your PCP, or from the city of Houston or Harris County. So that is great. And for the other 23%, we're hoping that this panel gives you some trusted information, but if not, each of us is a resource for you to help you learn more about COVID-19. And so thanks so much for that, Erin. So there's a lot of misinformation posted online and passed along to families, friends, and community groups. So George, you shared about your grandmother. How are you working to debunk misinformation and sharing what's really true?
Well, first, I'd like to acknowledge our senior pastor, Dr. Wright, and co-pastor Mia. They have set the tone of the stage to really listen to the medical experts and lead by example in managing our congregation. So we really, when we looked at the first stay-at-home orders, we were encouraging our members to stay at home, making them comfortable with worshiping at home. And I think that was critical in supporting the public health messaging. For example, we hosted the George Floyd funeral, and some people were a little discomforted that we were rigid about, mitigating COVID. So it's like you couldn't come in our congregation without a mask, without doing social distance. So again, and we were blessed that we had virtually no spread. We found that it was critical for us to provide our congregation with information that was both fact and evidence-based. And so we did a lot of linkages to the CDC website. In fact, Dr. Flash's organization, Avenue 360, we often put links right to Avenue 360, to Harris County, to the city of Houston, just to let our members know that we weren't just pulling this out of the air. We were really listening to the medical experts. And that was critical because last year, we have to acknowledge, we had an administration that dealt in misinformation, and they polarized this issue, and really caused great harm, I think, to our US citizens. And so again, we were, I think, again, very blessed that we were very forward in providing the right information to people.
Yeah, the right information is definitely critical. And so one of the things we want to do is put the readyharris.org URL out there for everyone. So Erin, if we could provide the readyharris.org URL and the phone number in the chat box, so everyone does have that information. And we're seeing that the CDC and trusted health researchers like Kaiser Family Foundation are tracking the demographics. And recently, Kaiser showed statistics that Black people in Texas represent about 19% of the cases, 10% of the deaths, and 12% of the population. And so far, only 7% of the people vaccinated in Texas. So we do have a tremendous opportunity. And so for all the panelists, we have an access gap. And so can you share what your organization is doing to close this gap? And so, Dr. Reed, if you don't mind, I'd like to start with you.
Great. So the University of Houston College of Medicine has hosted a webinar to try to inform individuals about, the vaccine and actually kind of dispel or counter some of the misinformation that's out there. We do have a federally qualified health center on campus, similar to Avenue 360. So we are able to immunize and vaccinate individuals regardless of their ability to pay. We're fortunate enough to receive some of the COVID-19 vaccine and have been administering the vaccine now since probably late January, early February. We're also trying to take some of the vaccine out into the community. We are working with some of the local churches. As we get more vaccine available, we're forming these partnerships to try to reach individuals that don't have a usual place of care and don't have a medical home.
Okay, thank you. Dr. Porter Sales?
So as a managed care organization and not an actual provider of care, what we are doing is we use our analytics, right? We leveraged and tried to identify our members based on the CDC's recommendation of where they will fit in the phase. Once we identify, we're going to make phone calls to them and try to see if they've had a outreach from their provider, reaching out to them to sign up. We've also offered the links that were just mentioned before so that our members know where they can sign up and then eventually get it, specifically if they were in the high risk categories with the age and the early phase of administration. So that are some of the things that community is doing, and we will continue to do and try to even partner with our other partners that actually provide the services like the FQHCs and then Harris Health System.
Okay. And so Dr. Barnes, can you share with us what Harris Health is doing?
Yes, so for those of you who are familiar with Harris Health, the majority of our patients are from communities of color. So the majority of our vaccines are actually going to communities of color. We have started administering vaccines in our community clinics, and those are based in communities of color and high need. We've also done some partnerships with the city of Houston that are very well advertised and promoted by our city officials. And we've done some partner vaccine efforts on Saturdays at our Setigas clinic and also at our Gulf Gate clinic. And so really our commitment and our core is to make sure that communities of color are well served.
That's great. And Dr. Flash, what are you doing from Avenue 360?
Great. The majority of our staff, as well as our patients, are from Black and Brown communities, and many of them, English is not their first language. So the majority of people that we're vaccinating are from those communities. But the other element of access, that's an access gap in communities of color, is also access to good information. And so we're also making sure that we do all we can to inform communities about where to access vaccine, to answer their questions, and to do so in a way that is accessible, not paternalistic, and to allow people to work through the process of understanding what's available to them and that it is indeed safe and can help protect them and protect their communities.
Okay. And then George, Fountain of Praise.
So we are partnering with organizations. I do have to be transparent and share that I really think we've got to be a little more innovative and aggressive about immunizing or vaccinating our community. In particular, I'm most concerned about those that are homebound and those that are not able to get out to the centers for whatever their reason. And so we've been kicking around the ideas of using retired nurses, of getting volunteers that can go and service those people that may be, again, homebound. We are blessed. We have partnership with Avenue 360, with Dr. Flash's organization. And so even early on, COVID testing, we were able to send our members, our staff to their site to do that testing. But again, I really think if we're going to get where we need to be in the African American and Latina communities, we've got to really think outside of the box. Now, given we all know that the supply chain issue, which I think is being addressed, and is getting better. But once that issue is resolved, we need to be like off to the races of making sure our people are getting vaccinated.
Absolutely. And Dr. Flash, I appreciate you bringing up the access gap to information, because we've talked a lot about COVID-19, but when we start talking about the new variants and the mutations, the question becomes, how effective are the vaccinations when we think of that? And so from your seat, maybe provide us some information of what you're thinking.
You know, I'm an infectious disease clinician, so this is one of my favorite things to talk about, because these are some of the most effective vaccines we have in our arsenal of vaccines. So the first one that received emergency use authorization was our Pfizer vaccine, which is 95% effective after someone receives 2 doses. Soon after, we received the Moderna vaccine, which is a similar style of vaccine. Both are mRNA vaccines, really effective because they give your body the instructions on how to make antibody and how to protect itself. And so that one had 94% effectiveness after the 2nd dose. And just this week, we now have a 3rd candidate coming across. As we think about the access gap and not having enough supply, I'm excited that we now have a single dose vaccine put out by Johnson & Johnson. So it's a little bit less effective. It's 66% effective for people who have moderate to severe disease, but it's 85% for those who have severe disease. And people who received the vaccine didn't have any hospitalizations or any deaths. So when you think about what are we really trying to do here, those outcomes are the ones that are most important to look at, making sure we keep people out of the hospital, keep those rates down, and keep people from dying. So we have really amazing options amongst all 3. So very effective.
Wow, thanks for that. And Dr. Porter-Sales, what would you say to people who ask that question about the new variants?
So to follow the science, right? Same to what Dr. Flash just said, you know, would you rather have no protection and then there is a variant? And in my thoughts, we probably will need a booster. There's been talk of the booster, right? Pfizer is looking at that, and so is Moderna. Will we need to do it yearly, or how it will look? More information to come on that. Similar to what we're dealing with when we're dealing with the influenza virus, it changes. It's a virus, and we know that that's going to happen. And so just hold to the facts, stay with the science behind it, and see, you know, look at the people who are leading you and providing these recommendations. We really have gotten our vaccines. It's been a while. We're doing well. You know, my own family was hesitant, meaning my husband is still he should be watching this video now and this live stream, this webinar with us, and getting his information. He is one of those that I'm still trying to coerce and tell him to follow the science. He thinks it's experiment. I'm like, you know, I wouldn't risk my life, you know, for that. And so I'm following the instructions. And if a booster is in the wind for me coming down the line, I'm gonna get the booster. I want to be here. I want to do my part, and I want to be an example for those and show them it's okay. You know, we never know anything. This is medicine, right? And it's called practicing medicine, but we follow the best information we have at the time, and there's more information coming.
Well, perfect. I think the one question that everyone wants to know, no matter what, is, will I still have to wear a mask and practice social distancing after I get vaccinated? So a lot of you on this call have been vaccinated. So Dr. Porter-Sales, let's start with you. Will I still have to wear a mask?
Absolutely, a resounding yes. Yes, until the recommendations from above come down, where the science says we have suppressed COVID, right? And I'll let others speak to this, but I know that some of our people, including my husband, is counting on the herd immunity. And so we still have this, you know, that's out on that. We don't know exactly what number it is. We have an idea. There's been, you know, information shared by Dr. Fauci. Is it 75%? Is it 80%? Is it 95%? What is it? And the answer is we really don't know. And you just really need to get vaccinated and just not count on the herd immunity that you're hoping for. But I'll leave it up to the rest of the doctors on the panel to comment.
Okay, Dr. Reed, what would you say?
I would say yes, too. So the issue is right now, we don't know whether or not people that have been vaccinated are capable of spreading the virus to others without getting sick.
Okay.
These sort of pre-symptomatic individuals that were spreading the virus around, and I think that's what made it so sneaky was that, people were catching it and not knowing that they were sick. And we don't want to have a similar situation where someone immunized and protected
I'll leave it up to
spreads
the
it to others. So that's why we recommend, continuing to at least wear a mask when out in public and avoiding large social gatherings until we get the all clear.
Okay. And Dr. Barnes, I'll give this question to you. Another popular question is, will I be cured for life or will I have to keep getting booster shots or yearly COVID-19 shots?
And so I think Dr. Porter Sales sort of gave an early response to that question. Although we're not absolutely sure, viruses do have a tendency of mutating. And the fact that Moderna and Pfizer are considering, or even beyond considering, they're starting to work on boosters, makes me think that very likely this will be similar to the flu, where periodically we're going to need a shot to protect us from the variant of the virus that's in the community at the time. So likely this will be similar to the flu and there'll be periodic shots.
Okay, and I know there's a lot of questions in the chat, and we will get to those in a second. I just have a few more questions for the panel that came in earlier. So earlier, Dr. Porter Sales talked about herd immunity, and sometimes we use that expression to describe enough people getting immunized against the disease that the chances of transmission and infection are very low. And herd immunity protects vulnerable people who can't receive the vaccine, such as infants and those who are immunocompromised. And so what will it take to achieve herd immunity and how will that help us? And Dr. Reed, let's hear from you first and then Mr. Anderson.
And before anyone responds, I just want to say that we have had a couple of comments come in asking if someone could please clarify what we mean by herd immunity in their response, please.
So when we talk about herd immunity, we usually think about other vaccine preventable infections like measles, like polio. So usually we have to have a high enough community immunity to where, people don't get sick. So when we think about measles, it usually has to be a little bit above 90% because it is so contagious in terms of vaccination or, preventing, widespread infection. So we don't know yet what sort of levels of vaccination or immunity that we'll need with the COVID-19 because it is so new. There have been some estimates that it may need to be 70% or a little bit higher. So we don't know at this point.
Okay, and George?
And so again, echoing what Dr. Reed said, we've calculated the numbers in terms of our congregation, which is about 26,000 people. We've estimated that at least 20,800 of our members need to either be exposed or receive vaccine. And even with that, again, I think, the exposure, when people think of herd immunity, I like calling it community immunity. There's a great price to pay for that. And death being one of the outcomes and hospitalization that we don't like that come along with that. And so I will say that, again, we've got to keep our guards up, for this herd immunity to kick in, like Dr. Reed said, with measles. And I was a kid that had measles. So, pre MMR shots and the like, I had measles, and it was one of my most horrific experiences as a child. And so I just say that with this COVID, which is, a novel virus, we're learning a lot about it. And so in my world, I think we need to be safe. So for example, some of the mitigation that we do at the church, it's here to stay. Even when we get to, a good, safe place, we will still be doing best practices in terms of hygiene, in terms of distancing, and in terms of monitoring, our crowds at the church. So I say that as we go along with this, we're going to learn. And I like the fact that I can't remember which doctor said it's practicing medicine. I think as this thing is evolving, we are duty bound to be responsive and to react according to the science, according to the data. And so I'm quite encouraged that will help get us along.
Wow. And so I think another very important fact is we talked about trust. And with trust, especially when it comes to the government, the question around privacy comes up. And so, Dr. Barnes and Dr. Flash, when people say I'm concerned about my privacy, is the government keeping a list? And do I need to keep a copy of my vaccination shot record? What's your response? And Dr. Barnes, let's start with you.
So there is some tracking of who has been vaccinated. There are databases, and again, this is all health information, personal health information, so it is protected and it can't be distributed wildly or carelessly. But there is tracking to identify and document who's getting vaccines. And then the CDC also has an app on your phone that you identify yourself as someone who's been vaccinated, and they keep track of symptoms. Because again, this is an evolving knowledge base as we learn more and more about the coronavirus and the vaccine. And the CDC, it's sort of its charge to keep us protected. And so they want to know if there are symptoms that are emerging so that they can communicate that to the public. So I wouldn't be concerned about your personal health information being used unwisely, but there are some tracking mechanisms in place for those who've received the vaccine.
Okay. And Dr. Flash?
I think that at least here in Texas, we take our privacy very seriously. And so a couple of things I'd like to add to what Dr. Barnes has shared is that the Texas Immunization Registry that is held by the Department of State Health Services, it is voluntary. And so adults have to consent to have their children in the registry, and then adults who have their immunizations in the registry, you have to sign a consent to say it's okay for your information to be put into the registry. The registry is a secure, it's confidential. The reason that's there is so that clinicians and schools can monitor people and know whether or not they've gotten their vaccine or whether they've not. I mean, sometimes I can't remember what I had for dinner last night. So next year, when someone says, did you get your vaccine at the right time? They can look me up. My doctor can look me up and say, yes, she got her vaccine in January. She's okay until such and such a time. And so it's really a tool to help keep each of us safe. But no one's big brother's not watching. Even the app, you have to voluntarily sign in and decide that you want to share your information and to share your symptoms. And I encourage people to share, because as more of us share information, we get more data and we can have a deeper understanding of how these vaccines are functioning to protect our community. So I think it's really important for people to agree to have their information registered for their own protection and for us to gain knowledge of the community and also to use the app. But it's voluntary and you have to consent. No, Big Brother is not watching.
Perfect. Thanks so much for that. I'm going to move to some of the questions we had come in. And so, Dr. Reed, I'm going to give this one to you. One of the attendees asked, I've been diagnosed with COVID-19 and I'm recovering. How long do I have to wait to get the vaccine? In other words, what is the time between recovery from the actual disease and getting the vaccination?
So with at least the Pfizer and the Moderna vaccines, it's recommended that an individual wait at least 90 days from the time in which they were infected with COVID to receiving the first dose of one of those vaccines. I haven't seen the recommendation with the Johnson & Johnson vaccine at this time. The reason why we still would recommend that individuals that have contracted COVID be vaccinated at some time in the future is that we've already seen individuals get COVID twice, sometimes more severe the second time around than the first time. So that's why we would recommend that even those that have contracted COVID during this past year, that they still pursue vaccination.
Okay, thank you for that. Dr. Flash, I'm going to give this one to you. We had someone asked, why have they not made a vaccine for kids under 13 years? Is the current vaccine too strong for them?
That's a great question. It has more to do with how we do research in the United States. Generally, we start with the populations where we think that there's the least risk of there being a challenge so that you can figure out if things work. So usually when we have medications or vaccines, you start with adults. Often you start with healthy adults, and then you expand to adults with other medical problems, and then you expand to pregnant women, and then you expand to children, to teenagers, and then you expand to young children, just so that we can have a stepwise approach in looking for how people are going to react. So I don't know if these vaccines are going to be, quote, too strong for children, but I know that that data is needed and the studies are underway because we want to get our kids protected as well.
Yeah, absolutely. And I think this was a really important question that came in. And Dr. Porter Sales, if you could help us answer this, if you get vaccinated and your period of incubation is surpassed, if you were to have contact with a person who who had COVID, would you be protected, or would you still have mild symptoms but not life-threatening? So they're trying to understand that I've been vaccinated, I came in contact with someone who has COVID. What would happen to me?
So first of all, we would hope that you would be experiencing, you've had the vaccine, some of that 95% protection that we spoke about, right? The effectiveness of that vaccine. The question that I think is still to be answered is, once I receive my vaccine, right, we have spoken about the booster, and we hope that when were you vaccinated from this exposure, how much time had passed? So that's a question you would really want to ask. And then you still want to get a test, right? We would want to have some tests. It all depends on timing. This is the question that I don't think that has been solidified in science. You know, I got my vaccine 3 months ago. Now I'm hoping that my immune response is there and I've mounted it, but I just came into contact with someone who had COVID. Do I go get this test? Will I experience symptoms or not? And the hope is that you won't. That is why we're here having this discussion and encouraging individuals to get this vaccine, because we hope that you will experience that 95% and soon to be possibly 66% that people will experience with the Johnson & Johnson vaccine. So I think there's still more to come on that. You still would do everything that you should do. You should probably quarantine and get tested and have a discussion with your provider after this. But we're hoping, the hope is that you are one of those who get that 95% protection. And then the question then becomes, is it 95% protection for 6 months, a year, 2 years? That information is still to come.
Okay. And then Dr. Barnes, here's a two-part question. If all of us got the vaccination, literally every one of us, would the pandemic go away? And as a follow-up to that circumstance, would the virus still exist?
Wow, that's a challenging question. I don't have a crystal ball. Certainly we'd be in a better situation if everybody got vaccinated, because we'd all have some level of immunity. Viruses often don't just disappear, and the vaccines aren't 100% effective. So there's a chance that it could still move through the community. If we're all vaccinated, though, the science shares with us that we wouldn't likely become severely ill and wouldn't likely need to be hospitalized. So I think we would all be better served if 100% of us were vaccinated. I might have to defer to Dr. Flash, the infectious disease specialist, on the likelihood that a virus would disappear, but that would certainly be a wonderful outcome if we all got vaccinated.
Absolutely. Absolutely. And then one last question, and we will, maybe Dr. Reed will take this. What's your take of those under 65 getting the pneumonia vaccine, since it's the primary cause of death regarding COVID?
Yeah, so we have some pretty good guidelines on that. So, you know, if someone have a pre-existing condition, they should get the pneumonia vaccine early. So, you know, people with diabetes, people with known asthma or COPD, those are individuals that are already eligible pre-pandemic for receiving that pneumovax early. I wouldn't say that we need to give it at the same time that someone is getting the COVID-19 vaccine, because the recommendations for the COVID-19 vaccine is to keep it at least 2 weeks before, or a 2-week window to where you haven't received any other vaccines. So I wouldn't jointly get those vaccines, but it would definitely be something I would consider.
Okay, we have about 5 minutes left. And so I want to do a final survey question. We've shared a lot of information. We've talked about trust. We've talked about safety. And so, Aaron, if we could put up the survey question, and I want to understand, after this conversation, have you changed your mind about the COVID-19 vaccination? And so we'll give people a few seconds to respond. Okay. Aaron, about what percentage of people have responded?
We're almost at 60%, so we'll give it about 5 more seconds.
Okay.
All right, here's what we have.
Okay. So 78%, they're ready to get their shot. So almost 80%, this is great. And then somewhat, but I still have questions, 11%. And at this time, I still don't plan to get the vaccination. And so for those that want more education, let's put the readyharris.org URL and phone number into the chat box so everyone has that information. Okay. And part of the data the University of Houston and Kaiser is tracking is around changing attitudes of people who say they would wait and see how the vaccine is going before getting their COVID-19 vaccination. That response tends to change to, I want to get it as soon as I can, when other people they know, particularly people that they live with, get their vaccines. And to me, that really demonstrates the importance of our conversation tonight and our work in the community to be as transparent as possible about the vaccine. And so in our last 2 minutes, let's do really quick. Any final thoughts? Dr. Flash, we'll start with you.
It's interesting that you have to convince your family members. My mother, who fits multiple of the criteria, just got her vaccine last week. A prophet is never expected in their own land. So that's saying a lot that she got her vaccine. She said, I'm never getting that vaccine. The government's trying to kill me. And then she's like, oh, I feel good. I feel energetic. I had a great night's sleep. And so, no, it's what I think what we're doing here is important, not just at our work communities, but also in our social and family circles, to spread the word and let people know it's important and it's safe and it's going to help us have a better future.
Perfect. Dr. Reed, anything to add to that?
Actually, I didn't have to have a battle with my family. They were all eager to get it because they see this as the path towards, sort of getting back to normalcy, as well as, COVID is scary. When someone actually contracts the virus, we really don't know how it's going to play out. We've seen individuals, up in their 80s as well as young in their 20s pass away. So, if this is the best chance to prevent that, that's, the way that I, recommend for myself, my family, as well as my patients.
Okay, well, with that, we have shared a lot of wonderful information. I thank each of you for your time tonight and for your expertise to share. And thank you so much for joining this vital conversation. Straight talk about the COVID-19 vaccine, particularly for Black Americans. So V is for victory. We thank you all for your time and thanks so much. Good night.